This is our 27-year-old trans female patient. So she had come for feminizing surgery. So now today we are planning to do feminizing top surgery. Feminizing top surgery majorly we do breast augmentation. So in many patients, those who have already started hormone therapy, they may develop little bit of breast gland. So in this particular patient, not much of breast development has happened, though she's on hormone therapy. But still we are now planning for breast augmentation uh, using breast implants. So before the surgery, discussing with the patient how much volume they desire, how much volume of breast augmentation we can do. We'll assess that by assessing the patient's chest anatomical features like skin thickness, chest circumference, and chest girth, uh, and many other anatomical factors. So we'll explain these patients and decide about the volume of augmentation possible in this particular patient. So, and another important thing in especially in trans female patients, usually they will have very broad shoulder and very broad chest. So, and very another important typical feature is widely placed nipple. So, nipples will be very widely placed, more of lateral side. So, we will explain the patient about possible position of the nipple post procedure, because it may not be visible in the midline, so it will be more of a lateral side. So we'll explain them very well, and we also give them option of correcting it in latent dates by medializing the nipples. So we'll explain all these things to the patient, and we'll decide about the volume of and profile of the implant. So in marking, we usually mark the midline and mark and to the 2.5 centimeter on either side of the midline, so that both the implants will not meet at midline, and we'll mark the possible boundary of the breast, possible breast tissue, and then we will divide into 4 quadrant, and we also mark the IMF fold. More typically in male chest, IMF fold may not be so prominent, so we have to identify the IMF fold. Then we'll take an incision in the IMF just below the IMF, and we'll after marking the boundary of the breast implant, we'll mark the nipple position from the midline, from the mid clavicular line. So usually done under general anesthesia. It's about 1 hour procedure and can be a day-care procedure. After surgery, we'll advise patient sports bra, which helps in maintaining the suture line and healing of the suture line, and also we'll discharge the patient in the same day. So this is the marking, complete marking for the breast augmentation in trans female patients. So we'll do the surgery now.